measure anxiety and cognitive function in relation to pain in dogs and cats?
I think that's one of the most exciting areas, and that's what I was thinking about when hearing this question about pain management research. So those questions about risk factors and early recognition, and because it is true, in humans we see this spectrum of conditions where we have depression and anxiety and fear of pain and cognitive dysfunction. It's an attention drawer, so executive functioning can go down. And then that becomes a very vicious cycle, social withdrawal. So we see all of these things. And there is some evidence that it's a two-way street, so that sometimes people with a tendency for chronic pain with anxiety or depression may be more likely to develop very serious chronic pain, and chronic pain may contribute to anxiety and depression. So I think that this is something where we really need to be getting on the ball with dogs and with cats. I think potentially starting with dogs is the easiest place to do it because we're starting to get the tools for cognitive testing. We have some that we can use in laboratory house dogs, but developing those that we can use in a clinically expedient way to look at cognitive functioning and early signs of cognitive dysfunctioning in dogs, particularly as we've talked about, these older dogs have all these comorbidities, including cognitive dysfunction, but talking about looking at younger dogs that have chronic pain may be a place where we can really start to pull that apart without those comorbidities.
So kind of moving on from that, I mean, Mark, you mentioned the other species, humans, and human medicine, and you brought that up, Margaret, as well. And we often hear this term, One Health, thrown around, and maybe in this context we could call it One Pain. But you know, just thinking about this idea of interdisciplinary collaboration between the human and veterinary side, Margaret, what areas of veterinary pain management do you think would translate well into research on the human side, you know, inform human medicine?
I think that certainly central and peripheral sensitization we've seen in especially in dogs, but also there's some evidence in cats, and that's an area that can translate well. Developing measures of frailty, gait speed, those sorts of things may be very useful. There's, I think, also a really important role for pets in drug development for humans. So as a proof of concept or on the pathway, because many drugs fail from the rodent research into human clinical trials, and efficacy in dogs and cats may be a really important intermediate.
Yes, I think it's when you start to read about this and you read figures such as in the last 25 years there have only been 4 new novel analgesics developed even on the human side, and those have been pretty much niche products, you realize that the translational research is somewhat failing. So I think there's a very important role for the use of companion animals and that spontaneous naturally occurring disease being inserted into that paradigm.